Welcome to the University of Pittsburgh Health and Explainable AI podcast, a collaborative initiative between the Health and Explainable AI HexAI Research Laboratory and the Department of Health Information Management at the School of Health and Rehabilitation Sciences, and the Computational Pathology and AI Center of Excellence, CPACE, at the University of Pittsburgh School of Medicine. I'm your host, Jordan Goss-Poire, a health and science reporter. In this podcast series, we explore the transformative integration of responsible and explainable artificial intelligence into health informatics, clinical decision-making, and computational medicine. From reshaping diagnostic accuracy to enhancing patient care pathways, we'll highlight how AI is creating new bridges between researchers, clinicians, and healthcare innovators. Led by Ahmad P. Tafti, Houman Rashidi, and Liron Pantanowitz, the HexAI podcast is committed to democratizing knowledge around ethical, explainable, and clinically relevant AI. Through insightful conversations with domain experts, AI practitioners, and students, we'll spotlight the latest breakthroughs, discuss real-world applications, and unpack the challenges and opportunities that lie ahead in responsible AI in healthcare. So, whether you're a student, practitioner, researcher, or policymaker, this is your gateway to the future of AI-powered healthcare. Today, on this podcast episode, we're going to speak with Ekaterina Kuldiashvili, Vice Rector in Research at Petreshatsi Tbilisi Medical Academy. We're going to discuss the responsible use of artificial intelligence in healthcare, public health, and medical education. Welcome, Ekaterina. Thank you so much for joining us. Would you like to introduce yourself?
First of all, I would like to thank you. It's my pleasure to be here. And I'm Ekaterina Kuldiashvili, Vice Rector for Research at Petreshatsi Tbilisi Medical Academy in Georgia. Tbilisi Medical Academy is a student-oriented medical university, and as a researcher, my everyday practice is guided by a simple but still ongoing question: how can research and digital tools, including AI, make learning and care for more meaningful for real people?
Can you tell us, how are you seeing healthcare practitioners adapting to the emergence of new digital tools?
In principle, we are going through the rapid digital transformation, but digital literacy in healthcare professional society as well as among the common society as well is still a challenge. From this perspective, this can create the tension rather than real benefit. Clinicians may feel that digital tools add workload instead of simplifying their practice and supporting care. Patients can feel lost in digital systems, especially when personal communication with their medical doctor is reduced. The challenge isn't technology itself. It's how we introduce it, how we are teaching it and using everyday practice.
Are you excited about all the AI applications that we're starting to see around us, like ChatGPT and Perplexity? And where do you see opportunities and concerns?
Again, great question. And yes, it will be quite stupid from my side not to use these all possibilities. And we should be very honest. All of us are using them. But here comes also another very important issue. What about the advances of usage of the technologies and also concerns? Let's start from the positive perspective. A value of AI is to support our everyday practice and improve efficacy of healthcare services and ensure our efficient work at every state and every moment. For example, I would like to share our experience of AI-enabled communication. We had a research project on cervical cancer screening, and we used AI-enhanced text and AI-generated visuals to explain the health information to society. Findings were very clear. When information was presented visually and understandably, people were more willing to seek further guidance from healthcare professionals. This reinforced something very simple for us. People act when they truly understand. But at the same time, we have some concerns about the ethical usage of AI And academic integrity in AI era is a hot topic. For medical university generates concrete concerns. AI is already part of how students learn, how research is conducted, and how decisions are supported. And we need to accept this reality. The key issue is not banning AI, but defining how it can be used properly and ethically. AI may assist with language, data organization, or information retrieval, but research questions, clinical reasoning, and diagnosis remain human responsibilities. In healthcare and education, integrity is not abstract anymore and never was. It is directly linked to trust and patient safety. AI should support reflection and decision making, not shortcut it. AI replaces thinking rather than strengthening it, then we haven't gained efficiency, we've lost responsibility.
You mentioned using AI to help educate healthcare providers and patients. Can you tell us more about your work in this area and your findings? Like, what kinds of educational approaches would you say are working?
Okay, I will try to explain. Partially, it is based on my feelings, but it also supported by the evidence that we gained from the interviews and surveys with patients. First of all, for me, it's quite difficult to understand. Cervical cancer, for example, might be preventable and can be eliminated because the vaccines are available. But here comes the some rigidness from society. They are not accept the vaccine, and it gives us the another challenge in the screening approach. Not too many females are enrolled whenever the screening is available, and etc. And even those females, those patients who are in the screening program, whenever we asked patients, they did not understand the diagnosis and the follow up of the pap smears. So that was our approach. First of all, we used the chat GPT just to simplify and rewrite the Bethesda terminology specific to the pap smears screening in common language, in understandable for the patient's language. And then we used the ChatGPT generated prompt just to bring the picture, emotion of the text, happy smiling face or a little bit curious, worrying one. And the approach and the outcome from the patients was absolutely different. Only texts give the up to 75% of follow-up and consultation with gynecologist, and AI visuals plus AI enhanced text even more than 90% of the follow-up. So this means that we should learn from this lesson how to communicate with patients properly. Yes, we are doing the great job. We are explaining everything very clearly with healthcare terminology, but if society does not understand this, our efforts are without real impact. We are losing our efforts and our even resources.
Are you finding that you're able to work with AI applications in Georgian as well as in English? Or are you seeing any difficulties?
In principle, Georgian language is among the most difficult languages, and that's why even the Google Translate, whenever we used before the ChatGPT era, we are not very satisfied by the translation results. But honestly, and I am following up this development of the artificial intelligence, last year, that time, ChatGPT was not translating so good in Georgian from the English text as nowadays. But of course, this is not the text that we can use as a copy paste without change something or tuning and etc. The polishing of the text is essential, and even sometimes quite strange phrasing appears that we are not using right now. But I presume that the same concern we have with English language texts as well. For example, I am not the native English language speaker, but whenever my student brings me the paper written by AI, I can easily recognize that, come on, it's not the style of the student, even in excellent English. It's quite machine language, and it's not the human touch, not the grammar mistakes or something like this. So I presume that ChatGPT will be developing continuously, and more we will use it in Georgian language. It will be trained because it's something like the more data will be accumulated at the databases, and afterwards it will continue the development. Sometimes it's very difficult and dangerous for the most part of the society that AI will be developing, but we can be on the safe side. It will not replace humans. We are unpredictable, we are making mistakes, we are emotional, and so on.
I'd like to switch topics right now and talk a little about responsible uses of AI in digital health. What kinds of projects are you working on, and what takeaways would you like to share?
First of all, and I suppose that a real example from our ongoing project, Erasmus Plus funded one, DigiChange, will be helpful. In long story short, what is DigiChange? This is capacity building educational project aiming digital transformation of medical and nursing education, just to integrate digital health elements and also AI possibilities in curricula. COVID-19 shows us that we are not ready to use the digital health routinely. So we have the great healthcare practitioners, great medical doctors, but they are not skilled to practice with usage of digital health. That was concern. And I presume that nowadays it's high time for the medical universities to think about this, which kind of skills we should provide to our graduates. This was the inspiration for the DigiChange. And of course, we need to increase awareness about the digital health and AI, not only among society, but also among healthcare professionals, because they understood that digital health is some machines, those are operating, and it's not the electronic medical record or health report or even the image that is sent by the colleague for the second opinion. In such case, to increase the understanding among the healthcare professionals and society, sometimes and very oftenly social media is very helpful to provide in a fun and attractive style. What is the digital health? How different is the digital health from the digital literacy? And what is the difference between the usage of AI in practice and only copy paste AI generated diagnosis? And it's also the point how we're positioning. If I will copy paste the AI written diagnosis, this means that I'm taking out the responsibility for a mistake because it's system generated one. But if I will not follow the red flag by AI based on the critical thinking and reasoning and etc. In such case, does it mean that AI makes mistakes, or it's just the overdiagnosis that is always the approach of the rapid tests, just to avoid disappearance of the red flag and etc. So this is the point that we are trying to deal with the DigiChange project, just to make the change at the faculty, students, as well as society level. Because society should learn that it's not the replacement of the medical doctor. It's just a tool that simplifies and ensures efficacy of the consultation. That medical doctor will not lose any important piece of the information because he is also a human being. And he's also tired.
You mentioned rapid diagnostics in digital health. We've been following advances in rapid molecular diagnostics and how companies like Oxford Nanopore Technologies are pioneering ways of using AI to power amazing new DNA and RNA sequencing tools. While preparing for your interview, we noticed a paper by Nastani Tukvatsi, head of the research department at the National Center for Tuberculosis and Lung Diseases in Tbilisi. The paper is called Clinically Evaluating Commercial Culture-Free Targeted Next-Generation Sequencing Testing for the Diagnosis of Drug-Resistant Tuberculosis. Are you excited about the future and about advances like these that are combining genomics and applications of AI?
That's challenging approach, and thank you again for the great question. So, I'm very excited about the new possibilities and new opportunities that the technologies are opening us the mind and also the different doors. But at the same time, we should be careful because it depends in which section and which field we are using. For example, if we are talking about the precision medicine and just sequencing of the genetical information, material, and etc., here comes the hidden point. What's about the epigenetics? Because we cannot explain fully based on the sequence and the genes. It might be correct gene, but not correcting properly because of the epigenetics, and vice versa. It might be problematic gene by the sequence, but balanced by the other genes focus and epigenetical approach. But if we are talking about the usage of AI for the modeling in silico approach, I am more than in love of this idea because in such case, every molecular biology research project will be more efficient because I can model on the computer and only afterwards successful protocol will be implemented in reality. So it's cost effective and much more impact and outcome oriented approach. The same is with the cell culture and etc. So opportunities there are a lot, but if we are exactly talking about the implementation in routine practice, I will be very careful. But from this perspective, one of the options that I can see can be very helpful. Usage of AI for quality assurance in healthcare settings, especially in the lab, because here comes the huge data analysis. I can look over the patient's complete blood count from day to day, and I cannot see the minimal change, but they are still very important from the quality assurance perspective because is my complete blood count analyzed working properly, or there is something that we should taking care about. So it's a mixed approach, and definitely for sure we should use, and I am excited, but in which section, how, and with which teams this should be considered, and what is the most important, educate participants in advance just to give them the all benefits and challenge to discuss to find their way, because approach that can be used by Pittsburgh University might not work for the Tbilisi Medical Academy or even the another Georgian university. All of us are unique and we should find our proper model how to proceed.
As the Vice Rector of Research at the Tbilisi Medical Academy, how would you like to see the University of Pittsburgh and other universities collaborate with your faculty and students?
That's a great question, Ian. Thank you for such kind of open welcome message to collaborate. I really appreciate this. In principle, our touch with the Pittsburgh University starts with the communication with Professor Liran Pantanovich, and he contributed to our annual conference in 2024. And afterwards, we continued the work with your director, Dr. Ahmad Taft. That's why he contributed this year annual conference to TMA with the very excellent workshop on AI usage in healthcare practice. Knowledge sharing. This is one of the possibilities where we can collaborate, and especially it's of utmost importance in case of AI because there is no exact rule how we can use AI. There are different models and we can learn from each other. And here I have in mind one question whenever during one of the meetings, one researcher asked, is the usage of AI ethical for this purpose and etc. And it was great answer from the board of speakers. If you have the question about the ethical approach, this means that your idea is not ethical. But whenever you are sure that you are not avoiding any regulations or procedures, this means that you are doing everything properly. So here comes again the point of the collaboration. There is no answer. We know the general rules about the cybersecurity, data protection, but what else might be considered additionally? Also, your experience with the analysis of the data, image data, and etc. Everything should be integrated in a teaching process in education because we don't have such huge experience in this direction. And we cannot afford training of our faculty. I mean the core group, but with AI and collaboration, again, we can learn. And at the same time, I think that it will be mutual benefit because you will take the real settings, what the faculty members not so educated in the field of AI, which kind of questions they can ask, which kind of concerns they might have, and which kind of stupid questions can be asked by the students as well as the faculty members. Additionally, this can open us the different perspectives with the research projects because right now, usage of AI for the prediction of pandemic or even preparedness of pandemic or even the revision of the healthcare protocols, it's also the possibility. And I presume that here there is no the one university's point of view. That's global view because we are serving the society globally from different continents, from different cities, but still the challenges are the same.
On this podcast, we like to ask our guests to offer students some research project ideas. Thinking about ways that students from our universities can work more closely together, what would you like to see students tackle?
Great question, and is especially in the field of my research focus at the TMA. What I'm really curious, and I see this challenge in Erasmus Plus project DigiChange, and I also find out the first findings from the cervical screening project as well. How we, healthcare professionals, students, and society trust and believe AI. Because even those of us who are intensively and for different purposes using AI, are we checking out how we are, which kind of questions we are asking? What is acceptance rate of AI in different societies and communities? I suppose that this question is not investigated and it strongly depends on the cultural knowledge differences and also the institutional approach, values, culture, and etc. But again, this is the third mission of the universities because we should find this solution that will give us possibility to serve society in our best mode. And here comes that one approach that can be done by the students of the different universities can give us the different vision and angles on the same topic and better understanding of it.
Ekaterina, it's been an absolute pleasure speaking with you. To close our interview, would you like to give a shout out to your team and tell us what's amazing about the Tbilisi Medical Academy? And why should students come to Tbilisi to study and collaborate with other students?
First of all, it's my great pleasure to acknowledge all my colleagues at Tbilisi Medical Academy and all my partners in Georgia and also globally. Without their collaboration, without their help and assistance, it will not be possible to realize all these ideas, and all these proposals will not be alive nowadays with their results. Why TMA? Why to come to TMA and study? Because this is the real unique medical university where we are implementing the processes in a student-oriented and at the same time faculty-oriented mode. So it does not mean that student-oriented approach replaces and makes the problem for the faculty. It's always the harmonized approach. Plus, we are ready for challenge to deal together with students. That's why the university serves with the open door principle, and also we love innovations. Without challenge and innovations, of course, we can make mistakes, but we learn from these mistakes. And this is the important aspect of the continuous development. Whenever we are happy, this means that no perspective of the development. Just to acknowledge someone, I will acknowledge the team, because the healthcare, it's the team-based work. And yes, we have the discussions inside, we have the different opinions, we have the different visions and etc. But here comes the truth. That's why I would like to wish myself to don't become rigid one who is following just own opinions and not accepting the other comments or even the suggestions. In such way, we will continue learn and grow and develop, of course, together with our international partners as well.
I love that. That's a perfect closing message. Thank you so much, Ekaterina, for joining us today on Pitt's Health and Explainable AI podcast. From the University of Pittsburgh, thanks everyone for tuning in and for following the series. Join us again on HexAI, where we explore the transformative integration of responsible and explainable artificial intelligence into health informatics, clinical decision-making, and computational medicine.